Alright, so if you want to take x-rays, I'm just going to go into a test patient. Alright, so you got to go to media on the left tab. And then over here, if it's the first one of the day, then it will say select a media bridge. So you're going to click on those three dots there. And then you have to choose OPG, whatever, just the one that starts with OPG. And if you are taking bite wing or PA, you have to make sure you turn on the Scanx. So the assistant should turn it on, but one or two times they've been wondering why it's not working and it's not turned on. So this button here, like press and hold to turn off and on. Okay. And then, so for bite wing and PA, you just press Scanx, and then it'll bring up your twain capture. Should we process one? Maybe. Wait. So while we're doing that, I'm just gonna take an X-ray of the big chain. Over here, there's two remote controls. There's one for surgery 2, one for surgery 3. Surgery 1 has a handheld x-ray, so it's different. So in surgery 3, just to wake it up, you push the man and you wait. Normally, I do it on 0.36 because before I was doing it lower and it was coming a bit grainy. Okay, so the yellow button, just push and hold, that light will come on, it'll beep, and then it's done. So at this point, the dental assistant will normally like get wipes, and they will wipe it for you, and they will scan it for you. But if you are the dental assistant, you will do that. Then once it's wiped, it's so hard to open. Okay, and then put it in, so the black side facing you, blue facing the machine. So these are size 2, and then size 1 is over here. But if you've got a size 1 x-ray, you can fit it in the size 2, but you can't fit size 2 and size 1. The small size over here, so we've got like some 1s and a 0 here. We've got 2 zeros, 2 1s. And each room should have its own size 2s in the room itself. Once it's scanned through, then wait, did it have the ready thing on? Okay, so down here, I think we clicked something else, so it went away, but that is usually there, and you'll see the x-ray going through here, and then this page will automatically show up when you're finished. If you want to orient the x-ray, you can orient it. Usually, so I'm just going to do what I normally have to. You have to rotate to the right, and then very, very important, flip, because it always comes through mirror image. I don't know why. It's weird, it annoys me, but that's just how it is. So whenever you process an x-ray, it'll be mirror image. If you get Shiner as a dental assistant, she'll orient it correctly. If you get Tanya, she won't orient it at all. You just do it yourself once it comes in core practice. If you get Anna, she'll probably do something, but it'll still look weird. So just maybe tell Anna not to orient it. Oh yeah, and then you have to put them in here to delete them, because if that ScanX doesn't actually delete it, so you have to separately delete it in this machine, the eraser. Okay, save it. Up here, the little circle button, you click on that, and then you wait, usually for quite a while. I don't have that much patience, so here it is. Normally I close it before it actually. Alright, and then after you finish processing how many x-rays you want, then you can close the twain capture so that it doesn't like process someone else's x-rays on that patient's file. And then here, provider, you just like choose yourself, and then for some reason, if it's for a different date, you can choose a date here, but otherwise you can just, yeah. And then category, you can select from the list, like intraoral x-ray, and then if you really want to, you can choose that it's, you know, like a bite ring or which tooth or something. If you choose which tooth, then let's choose a tooth number. So I chose tooth 1-4, and then when you save it, it says 1-4 on it. So you'll know which tooth it is, but you don't have to do that. Okay, now if you want to take OPG, should we make a separate video for OPG?